Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about a very common cause of dizziness that many people feel but don't fully understand. It happens suddenly. You turn your head, sit up in bed, or look up at a high shelf, and for a few seconds the whole room spins. That feeling can be scary if you don't know what it is, but the good news is, in most cases, it's not dangerous. So today we're going to explain it clearly: what causes it, how doctors diagnose it, how to treat it, and when to get medical help. Doctor, a lot of people say they feel this sudden spinning sensation when they move their head. What could be the reason for that?
That spinning feeling is called vertigo, and one of the most common causes is something called BPPV. The name sounds long, but the condition itself is simple to understand.
So what exactly is BPPV?
BPPV stands for Benign Paroxysmal Positional Vertigo. Let me make it simple. Benign means it's not life-threatening. Paroxysmal means it comes suddenly in short attacks. Positional means it's triggered by head movement. And vertigo means a spinning sensation. So BPPV simply means short attacks of spinning dizziness that happen when you move your head in certain positions. It comes from a small balance problem inside the inner ear.
How long does the dizziness usually last in BPPV?
Only a short time. Most of the time, the spinning lasts just 10 to 30 seconds. It stops when the head is still, but it may come back again when you move.
So what exactly is happening inside the inner ear that causes this spinning feeling?
Inside our inner ear, we have a balance system that helps us stay steady. There are tiny calcium crystals that normally sit in one part of the inner ear. But sometimes these crystals become loose and move into a place where they should not be. When they move into the balance canals of the ear, they interfere with the normal movement of fluid there and send the wrong signals to the brain. So even though your body is not moving, your brain thinks you are moving, and that causes the spinning sensation.
So BPPV happens when these tiny crystals move out of place.
Exactly. That's the root cause. The crystals are harmless, but when they move to the wrong area, they confuse your balance system. That's why the dizziness comes suddenly with head movement.
Why do these crystals become loose in the first place?
There are several reasons. It can happen after a mild head injury, after an ear infection, or after lying in bed for a long time. It's more common as people get older, especially after age 50. It can also happen after dental procedures, like drilling, because of the vibration. But in many cases, it just happens without a clear reason. One important point to understand: BPPV is not caused by stress. It is not caused by anxiety. Many people think that, but it's not true.
What symptoms should people look for if they suspect BPPV?
The main symptom is short, spinning dizziness when moving the head. Some people describe it like the room suddenly tilts or spins. Others feel pulled to one side or briefly lose balance. There may be mild nausea, but it usually passes quickly. Very important: BPPV does not cause hearing loss, it does not cause ringing in the ears, and it does not cause numbness, weakness, or fainting. If those symptoms are present, then it is not BPPV, and we must think of other causes.
So if someone feels dizziness like this, how do doctors confirm that it is really BPPV?
BPPV is usually diagnosed with a simple test in the clinic, not by scans or blood tests. The most common test is called the Dix-Hallpike test. It's quick and safe.
What happens during that test?
The patient sits on the exam table, turns their head to one side, and then lies back quickly with the head slightly hanging off the edge. If loose crystals are inside the balance canal, That movement makes them shift and triggers a short burst of dizziness. During that moment, the doctor also checks for a specific eye movement called nystagmus. If both dizziness and that eye movement appear together, that strongly suggests BPPV.
So some people worry when they feel dizzy. They think it might be something dangerous like a stroke. When should dizziness be a warning sign?
That's a very important question. BPPV itself is not dangerous, but dizziness can sometimes be a warning sign for something serious. So here's a simple rule. If dizziness happens alone and only with head movement, it is more likely BPPV. But if dizziness comes together with other symptoms, that is a red flag. If someone has dizziness with weakness, numbness, difficulty speaking, facial drooping, double vision, severe headache, fainting, trouble walking, or chest pain, that is not BPPV, and they should get emergency medical care immediately. Those symptoms could mean stroke, heart-related dizziness, or a serious neurological condition.
So dizziness with these warning signs needs urgent evaluation.
Exactly. Before diagnosing BPPV, doctors also think about other possible causes. We compare it with vestibular neuritis if dizziness lasts for hours, Meniere's disease if there is hearing loss and ear pressure, migraine-related dizziness, post-head injury dizziness, or medication side effects. And if there are neurological symptoms like weakness or speech problems, we must rule out stroke first. Once dangerous causes are ruled out, we can safely diagnose BPPV.
Now that we understand what BPPV is and how doctors diagnose it, the big question is, how do we treat it? Many people think they need medicine for dizziness. Is that true?
Actually, no. Medicine does not cure BPPV. Some tablets, like motion sickness medication, may reduce nausea for a short time, but they do not solve the root problem. BPPV is a mechanical problem in the inner ear, so the best treatment is also mechanical, not medication.
What do you mean by mechanical treatment?
We treat BPPV using repositioning maneuvers, specific head and body movements that guide the loose crystals back to where they belong in the inner ear. The most common and effective one is called the Epley Maneuver.
How does the Epley Maneuver work?
It's simple. Let's say the problem is in the right ear. The person sits on a bed and turns their head slightly to the right. Then they lie back slowly, keeping their head turned. After waiting for the dizziness to stop, the head is gently turned to the left. Then the person rolls onto their left side. After a pause, they slowly sit up again. That sequence uses gravity to move the loose crystals back where they should be.
And if someone has BPPV in the left ear?
Then the same steps are done on the opposite side. It's a simple mirror movement.
Can people do this maneuver at home?
Yes, but only after a doctor confirms BPPV and explains which ear is affected. It is better to do it with guidance the first time. People with neck or back injuries, severe osteoporosis, or recent stroke should not do it alone. And if it causes pain, they should stop immediately. But when done correctly, it is very safe and often gives fast relief.
How long does it take to feel better?
Some people feel better right away. Others may need to repeat the maneuver once or twice a day for a few days. It is normal to feel a little lightheaded afterwards, but that improves quickly.
Once someone feels better after treatment, is there anything they can do to prevent BPPV from coming back?
Yes, there are simple habits that help. For the first couple of nights after treatment, it's better to sleep with the head slightly raised on pillows. When getting out of bed, move slowly instead of rushing. Try not to throw your head back suddenly, like when looking up at a high shelf. Staying hydrated, managing sinus or ear problems early, and keeping good posture can also help reduce dizziness.
So they don't need to stop moving completely?
No, and they shouldn't. Avoiding movement actually makes balance worse over time. BPPV is not a disease that means you must rest all day. The goal is to move normally but gently. Confidence returns when people understand their condition and know how to control it.
Is BPPV dangerous? Can it damage the ear or brain?
No, BPPV itself is not dangerous and it does not damage the brain or nerves, but it can increase the risk of falling, especially in older adults. That is the biggest concern. So if dizziness happens, stop, sit, and wait a few seconds until it passes before moving again. Safety first.
So the real risk isn't the dizziness itself, but losing balance.
Exactly. Another issue people experience is worry or anxiety. After a dizzy spell, some people become afraid to move. They avoid turning their head or lying down because they fear the spinning will return. But once they learn how to manage BPPV and understand it's treatable, that fear goes away.
Before we finish, could you give our viewers a simple summary they can remember?
Of course. BPPV is a common cause of short, spinning dizziness triggered by head movement. It happens when tiny balance crystals inside the inner ear move out of place. It is not dangerous, but it can be uncomfortable. It does not cause hearing loss, weakness, or fainting. Doctors diagnose it with a simple movement test, not a scan. The best treatment is the Epley Maneuver, not medicine. Most people recover within a few days. But if dizziness comes with weakness, difficulty speaking, severe headache, chest pain, or vision problems, that is a red flag and needs emergency medical care.
Thank you, doctor. That was clear and helpful, and I believe many people will now feel more confident about managing dizziness the right way. Thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. Take care of yourself, take care of your family, and remember, your health is your wealth. Stay safe, stay healthy, and we'll see you in the next episode with another doctor tip you can trust.